Welcome to the 2-Minute Radiologist. Today we'll talk about the sale sign of the elbow, a potential clue to a subtle fracture. One of these elbows is normal, the other has a fracture. Let's figure out how you can tell which one is abnormal. The elbow normally has two fat pads, one anteriorly located in the coronoid fossa of the distal humerus, the other tucked into the posteriorly located olecranon fossa. These fossae are very deep. In the absence of a joint effusion, the posterior fat pad is invisible, and only a thin sliver of the anterior fat pad is visible anterior to the distal humerus. If there is a joint effusion, like a hemarthrosis following a fracture, the anterior and posterior fat pads are pushed anteriorly and posteriorly respectively and become visible on an X-ray. The case on the left is normal. A sliver of the anterior fat pad is visible anterior to the distal humerus, but the posterior fat pad is invisible. The case at right shows anterior displacement of the anterior fat pad and posterior displacement of the posterior fat pad. Anterior displacement of the anterior fat pad is called the sale sign. Strictly speaking, posterior fat pad displacement is not a sale sign, but the pathophysiology is the same. The frontal view at left of the injured elbow shows a non-displaced radial head fracture. The most common elbow fracture in adults is a radial head fracture, typically after a fall on an outstretched hand. In children, fat pad distension after a fall on an outstretched hand is most often due to a supracondylar fracture. But be careful. Fat pad distension must be evaluated in context. This patient had no trauma history and several years of polyarticular pain and had rheumatoid arthritis causing a joint effusion. In the absence of trauma, consider arthritis if there is fat pad distension, including septic arthritis. Thank you.